Okay, I have 4 minutes. Now it's very short lecture. After you listen to this, I will talk about the principle of deformity correction. I think this all of you know well that you have to do osteotomy, right? And the concept is here. Very short to say the chora, you know, and then if you have, we call angulation correction axis, it means kind of bisector line. I will show you, and the osteotomy point. That is 3 factors that will determine. And when you do deformity correction, you can say the effect that you want is angulation only, mostly. And it may happen like you have angulation and translation. You have to be careful with translation, is it as you plan or not. Okay, let's see 3 factors will make this happen. So you will have this chora, right? And then if you bisect this line, bisect this angle, we call transverse bisector line, and the correction axis is along this rod, like this. You will be able to correct if you put the hinge at the another chora, maybe in the center and away from the center. It will be correction. If you do osteotomy there, like this. Everything is in the bisector line. The axis will be, you can put the hinge anywhere here. For example, in this case, you have chora here of the bone, and then you put the hinge to be a chora to detect the deformity along this axis. You will have this osteotomy here, and then you have correct open wedge. Simple, right? And then if you move this hinge, the chora of the bone here, they move to the convex side, and you do the correction, you do osteotomy here, you have closed wedge. And then, again, another scenario, if you have this, and you use this hinge, but you do another osteotomy. Let's say you put the hinge, and then you put the osteotomy away. You can correct, but with kind of crooking, I mean, cheating a little bit, that there will be something wrong because you're error, or you like to have this. And maybe you intend to do so because it is in the joint. The chora may be here, but you cannot do osteotomy here very thin. You have to cheat a little bit by moving the osteotomy away from the joint. You have to accept this kind of correction, but have some translation. The opposition of the bone will be different. You may have some prominent, accept that, okay? But things that I don't like you to do most of the time is like this. You are wrong in the hinge position, like this. And what you can see, you can make it parallel, but it's not deformity correction, it's translate. The angle is correct, but it's translate. Okay, maybe some reason that you have to do this way, I don't know. Okay. So let's this, we can say this is the osteotomy rule number 1, 2, 3 that you have to remember. Number 1 is if you have this along the bisector line, you can realign whatever at the center, medial, concave or convex. You can realign by open wedge or closed wedge. You have to remove the bone or not. We call correction of the angulation is possible, but if the osteotomy is away, but the chora and hinge is on the same bisector line, you can correct, but you translate. This is rule number 2. But the number 3, if you have the ACA, I mean the axis of correction is here, not on the bisector line, you have still deformity left. So in summary, effects of position of the chora of the bone, or you bisector line, and then you put this we call angulation correction axis, and then the osteotomy. This is what you have to do today, and you know the osteotomy rules. Thank you for your attention.